All right, well, I might kick off then, just so we've got enough time to maybe get through what I'd wanted to talk about and then have some time at the end if you want to ask questions. So, when Sophie got in touch with me, my understanding is that you're a group who are interested in sort of like lifestyle interventions in medicine, and how that could be useful in, I guess, in clinical practice, but maybe also for yourselves, I might sort of suggest. So what I mostly want to talk about is mindfulness today, but how I think that maybe relates to our own well-being as practitioners and people working in healthcare, but how we can also think about the benefits and advantages it might have for patients as well, and how we can think about bringing it in some way, or how we might use it when we have interactions with people. So I hope that'll be the sort of thing that'll be interesting to you, and very happy to talk about related things at the end, or just happy to answer questions. Unless I've sort of said something that you really don't feel you've understood, or it's sort of a real burning question, I might suggest holding questions to the end. But if there's something very particular you want to ask, just sort of stop me and I'll try and answer it. Okay, so I'm going to just share a screen quickly. You seeing a PowerPoint type thing? Great. Oh yeah, just encourage you to keep your cameras on. It's great to see an audience rather than just talking to people's names. If you can't, obviously I understand, but it's nice to be able to judge people's reactions, how things are landing with you. So I've called this mindfulness and well-being, and I think there are challenges and opportunities in this space. My name's Joe Starke. I'm a psychiatrist. I work at Box Hill Hospital. We certainly have one of our students rotating with us sometimes, so who knows? I might encounter some of you if you rotate in my team. So I want to read you a poem called The Guest House, and some of you might have heard this poem before. It's by a poet called Rumi, very famous Sufi poet from a number of hundred years ago. He's written a lot of great stuff. This is obviously translated. This wasn't originally written in English, but I think the translation is pretty good. And I think it speaks to some of the themes that we touch on in mindfulness. So it's called The Guest House. This being human is a guest house. Every morning, a new arrival. A joy, a depression, a meanness, some momentary awareness comes as an unexpected visitor. Welcome and entertain them all. Welcome and entertain them all, even if they're a crowd of sorrows who violently sweep your house empty of its furniture. Still, treat each guest honorably, who may be clearing you out for some new delight. The dark thought, the shame, the malice, meet them at the door laughing and invite them in. Be grateful for whoever comes, because each has been sent as a guide from beyond. And the reason I like that is I think it speaks to me about acceptance, and that's a starting point. It doesn't mean we have to not work towards things being different or better in some way that we might feel that it should be. But at any point in time, acceptance is a useful starting point. And then we maybe are freed up to make changes and adjustments to things. But we don't always get everything that we might think we deserve or should have. And can we welcome in the things that just happen to be happening, rather than being frustrated or pushing them away or wishing it was somehow different in the moment when they're happening. So maybe just something to think about. So why mindfulness, and why am I interested in it, or why am I wanting to talk to you about it? So I think it's obviously a buzzword. We hear a lot about it. I think there are some really exciting clinical benefits when people are able to practice mindfulness consistently. I think there's also some really interesting neurobiological effects, and maybe there would be a link between the clinical benefits and that. It's also a very strong interest area for me. I've had the privilege of working with Sophie's dad in this space, which is somehow how we got connected, I think. And we've had the chance to learn a particular type of mindfulness practice which is used in medicine. And I think it's certainly been of enormous benefit. My own practice of it has been really helpful for me to cope with the clinical work that I do. I also have a research interest in this, and I've now more recently done a lot of work with colleagues and with patients using mindfulness as part of those interactions. Now, I've just got a problem with my screen. Oh. Okay, so mindfulness is everywhere, including on the cover of Time magazine. So maybe that's part of why it's this sort of buzzword. It's much more in the media. But that's probably a good thing, because mindlessness is also a pretty big thing. This guy, you've got to sort of sympathize with his situation, and maybe you can relate to some of what he might be going through. This overwhelming information overload. I mean, he doesn't even have his phone out, but social media, internet, the sense of busyness, of overwork, always ruminating and worrying about lots of things. And we can get very distracted and mindless in the way we approach a lot of the situations we're in, conversations, relationships, clinical interactions, things that we've got to do every day. And can mindfulness as a practice be an antidote to some of that, and maybe relieve some of the sense of being burdened by the experiences of life? I think it can be. So what is it? This top quote is from a man called Jon Kabat-Zinn, who many would sort of regard as the grandfather of the modern mindfulness movement. And he said that mindfulness is paying attention in a particular way, and that is on purpose, in the present moment, and non-judgmentally. And then another way to think about it maybe is sort of a decentering from our arising thoughts, emotions, and sensations, rather than sort of getting drawn into our experience, the ability to sort of hold a more background awareness of what's coming up for us moment to moment. A state of equanimity maybe, so not being overly impacted by whatever might be going on, being sort of keeping an even keel through some of the storms of life. And then in short, just being here now. And Be Here Now is the title of a really great book, which is worth finding if you can. So where does this come from, this practice of mindfulness? And it's certainly a central component of several Eastern spiritual traditions, particularly Buddhism, but also Hinduism. But it's in its modern form can be traced to the stress reduction clinic and the mindfulness-based stress reduction program, which was founded by Jon Kabat-Zinn at the University of Massachusetts. And that's in 1979. So we sort of 44 years into this revolution, I guess, in the modern sense. And I think there's been a lot that's been happened in that time in terms of sort of refining what constitutes mindfulness. This is one of the books that he wrote, which I think is definitely worth reading. Very detailed description of his program, which is Mindfulness-Based Stress Reduction. And, very accessible, well written. I mean, although a lot of people would learn this practice through doing a course, in person, in a group setting with teachers, the idea is that from this book you could learn the practices. So just something to think about if you've got an interest to sort of take things further. So sometimes I think a good metaphor for the mindful state is that it's a little bit like the sky. We'll have weather patterns across the sky, like clouds and wind and rain, and they'll move across the sky, and they'll sort of fill the sky at times, and there'll be lots of things happening in the sky, and then they will go away again. And throughout all of that, the sky remains unchanged in the background. So even though all those things are happening, the sky isn't really affected by that. And obviously the sky is an illusion anyway, but the sky is sort of unchanged by these things, but they happen in the presence of the sky. And the mindful state is something like the sky, and thoughts and emotions and sensations in our bodies are something like the weather patterns that come and go and change moment to moment. Another way to think about it is that mindfulness is maybe the ability of the surface of a pond to restore itself after it's been disturbed. So you drop something into a pond and you get ripples and they spread all over, and maybe there's on the surface of the sea, for example, there'd be waves, but the surface has this ability to resettle. When those incoming disturbances and perturbations go away, the surface restores itself again, and the lake becomes placid once more. And maybe mindfulness allows us that ability to settle again after something has come up for us. And this is maybe the skill that we're training when we're practicing mindfulness. So it's also important, I think, to say what it's not. So a lot of the time people turn up for a mindfulness session or go and do a course with the expectation that they afterwards always going to feel peaceful and relaxed. And it certainly is possible that in practicing mindfulness regularly, we might over time be more easily able to access feeling more relaxed, more peaceful. But in any individual practice doing mindfulness, it's not guaranteed or even necessarily a goal that we're aiming to feel relaxed. We're aiming to be more mindful. And that can include awareness of distress and awareness of pain in the body or difficult emotions or frustrating thoughts that are arising. And the fact that we're noticing those things doesn't mean we're doing it wrong. Those are just the contents of our awareness at that time. And in practicing mindfulness, we often are more aware of those things. And that can sometimes be quite triggering for people because they thought, well, I'm doing this practice, I was expecting to feel relaxed, and here I am feeling quite uncomfortable, and there's something going on here, maybe I'm not doing it right. And especially if we're going to bring this to other people, including bringing it to ourselves, I guess, is to remind ourselves of that it may not necessarily always be a peaceful and relaxed experience, but it is something that over time can offer that. It can certainly allow us to more easily access the ability to settle ourselves even if something difficult is happening. It certainly also doesn't guarantee that we'll never be stressed, but it does provide a way for us to cope differently with stress. As I was saying, we may well still struggle with difficult thoughts at times, but we will have additional tools in how we navigate that experience without it feeling as if those thoughts take over. It doesn't mean you have to become a monk or a nun and go and live in the forest in a cave in order to practice this. And the whole idea with what's regarded as the secular mindfulness movement is that it is something that you practice within the life that you're in. You don't need to sort of separate yourself from the things of day to day, which is why he called his book Full Catastrophe Living. So within the sort of busyness and fullness of life, it's possible to practice mindfulness without it having to be that we go on a retreat and we have to break away. Although those can be very valuable experiences and often very worthwhile, that's not possible all the time. And it is a somewhat artificial environment going on retreat. And it's definitely not a panacea. And this really overlaps with how we bring it into healthcare settings. A lot of people, health services or certain people will sort of pitch mindfulness as, well, this is going to solve all the problems, this is going to sort everyone out. If we just do some mindfulness and everything's solved and everything's fixed. And I think, again, that's quite unrealistic. But that doesn't mean it can't offer something of value to people who are struggling with chronic illness or pain, these kinds of challenges. But we've got to make sure that we're explaining that it doesn't mean everything's solved just because we're doing mindfulness practice, but that's certainly not a reason not to do it. It often involves a lot of this. So this is my cartoon self meditating. Often a sitting meditation is a very common form of meditation, but standing meditation, absolutely fine. We often do meditation lying down, so the body scan meditation, some of you may be aware of, is a very sort of popular way to practice mindfulness, and these businessmen having their mindfulness session. But yeah, you can. For some people, lying down isn't sort of a thing that they necessarily feel comfortable doing. And again, if we're going to bring this to other people, we've got to allow the scope of ways in which to practice. So for some, particularly if we think about women who may have experienced sexual trauma, this is a very vulnerable space. And so for us to go, okay, now we're all going to lie down and practice some mindfulness. For some people in a group or in a room, that's going to be very, very difficult to do. And that might be a reason why they find that, I can't do this then, and feel sort of excluded or to the side. And we've got to often allow several options when we introduce practice to say, we're going to do a body scan practice. For many people, we would suggest doing this lying down. For other people, you might want to choose to sit in a chair. You can even do this standing up. Often we invite people to close their eyes when we do practice. But again, for some people, that feels very vulnerable. You're in a room with people you don't know. Is it safe for me to close my eyes? Maybe not. And we can invite people to say, we would encourage you to close your eyes if that feels comfortable, but you might want to just adopt a soft gaze and gently close your eyelids partially and fix your attention on the middle distance rather than making eye contact with anyone. And so we're allowing some spaciousness without people feeling like they're going to do it wrong or that, there's no right way for them within a particular practice. And mindfulness is very accepting of this sort of thing. There are types of meditation which are very, very rigid. There's certain types of Eastern meditation where you will literally get hit with a stick if you don't sit properly. And that's part of the way that type of meditation is set up. If you're turning up for that, you would know that. And the idea is that, you've got to sort of adjust your posture in certain ways and you're going to get kind of corrected. There isn't anything like that in modern mindfulness practice. I think that's a good thing, but I think it's important for us to embody that in what we might bring to others to allow for variability in how people practice. How they might sit, how they might hold their bodies. We've all got unusual individual things about our bodies. They don't all work the same, and we've got to make space for that, I think. Walking meditation is great. It's very, very accessible. We can bring this into any day. As people are able to walk, which is very lucky that we have that ability, we can use mindfulness when we walk as a way to really tune into our bodies, bring ourselves into the moment. And it's often just something we can fit in, walking from here to there, between rooms, in the house, between places. If we, working in the hospital, we can just easily find just a few steps to slow down and really focus in on the sensations of our feet touching the floor, the movement through our legs and our body, how our body shifts its weight and balance as we walk. And this, by noticing sensations in the body, we draw ourselves into the moment, because our sensations are always now. They can't be yesterday or tomorrow. Only our thoughts can really be those things. And often we spend a lot of time in yesterday and tomorrow. If we use sensation as a focal point, we draw ourselves into the moment, and that becomes very valuable in then connecting more with everything that's going on around us. So it's sort of like a doorway. We often focus a lot on the breath. And again, this is something very accessible. Our breath is always with us, hopefully. When it's not, that's a problem. And John Kabat-Zinn, one of the things he would say is, as long as you're still breathing, there's more right with you than wrong with you. And you have this tool that's available to you. So breathing is very interesting physiologically in that it's both under involuntary and voluntary control. So we've been breathing since we were born. Most of those breaths were completely out of our awareness. We were just doing them. Our body just runs the show. But we can become aware of our breathing and become very conscious of the sensations and then regulate how we breathe. But we can also just leave it to the automatic process, and it'll just keep happening unless there's some an obstacle to our breathing. And using our breath then is something that's always available. We can again bring ourselves into the moment, because our breathing is always happening right now. So if we focus in on the sensations of breathing, and that's where our attention is in the moment rather than somewhere else. Sometimes we spend time eating raisins in mindfulness practice. So I don't know if anyone's done a raisin eating exercise. It's meant to be a little bit kind of quirky and unusual. It's not the sort of thing people expect. And often, there's a bit of humor around it. And the idea is that we do something that we maybe done many times on sort of almost like automatic pilot. And most of us are eating on automatic pilot most of the time. We don't really notice our food much. We're not tuning into the sensations as much as we could. And with this practice, you eat a single raisin, but it takes about 10 minutes. You really slow everything down, and you sort of experience all the sensations step by step. Little bit by little bit, you sort of notice the texture and the smell and the taste, and eventually the feeling of sort of swallowing a raisin. And it's a exercise in expanding the sort of channels of receiving of what's going on. We sort of widen our perspective on things that we can notice, which usually are just below our level of awareness. We're thinking about what we've got to do tomorrow, and we're just munching raisins by the handful. Whereas this is a way to really slow down and prompt us to tune in a different way. And that can go for mindful eating more generally. It doesn't have to be raisins. It could be something else as a substitute. But the idea is to sort of just shift where our attention is and use almost these prompts to focus differently. So in the end, it doesn't really matter what we do, because every moment is an opportunity to be mindful. So mindfulness of washing the dishes, mindfulness of vacuuming the carpet, folding the laundry, mindfulness of an interaction with another person. It's much more about bringing a particular type of awareness to how we do things while we're doing them, rather than any particular practice. And I think that's a useful thing in how we can bring it into day-to-day life. So what's all the fuss about? Why is this such a big thing? So it seems to help a lot of people, both in the sort of general world and in patient populations, and also in the corporate world. So, money's coming into this. There are certainly some changes in the brain. I'm going to talk a bit about that. And that's true both during mindfulness practices, so while you're actually practicing mindfulness, but also if you sustain practice regularly, there are progressive changes in your brain. And there's a lot of debate about how to make this accessible and available to people, because doing an 8-week intensive course is not easily accessible to a lot of people. There's a cost aspect. You've got to have time available. There's a number of other barriers for certain groups in the population who may never get that opportunity or never be able to have that. How can it still be accessible in some other way? And as I was saying before, for people who've got certain limitations, particularly experiences of trauma from the past, how can this still be an accessible thing without it being overly triggering? Because we want this to land in a useful way, not to be something that sort of upsets people and pushes them away from it. And I think a lot of work is happening in all these areas to try and answer some of these questions and make this the most sort of easily accessible and beneficial offering that we can make it. But is it being stretched too far? So you get sort of mindfulness of everything, right? So mindful parenting, mindful eating, mindful politics, are we a mindful nation? Mindfulness, it's just sort of overdone. And you've got to sort of ask yourself the question: who's doing it right? We've got sort of the Buddhist monk on the right-hand side of my screen in front of the lake, and then you've got Ronald McMindfulness on the other side. I think there's a chance for this very valuable thing to be diluted or distorted in ways that aren't necessarily good. I think accessibility is important, and flexibility in how this is brought to people, and not being rigid in holding on to sort of you know, notions of it that aren't helpful to people, but there probably is a core in it that should be maintained with integrity. And I think there's the risk in the way things happen in the media in the modern world that can be distorted. And then people can encounter a distorted version of mindfulness that won't necessarily appeal to them or land in a useful way. And then they don't end up following through with it. And if we start to work in this space, I think part of the obligation of doing that is to try to nurture that core of integrity in yourself so that you more easily are able to convey that to other people rather than only relying on sort of a manual or a book, which is very helpful, and that's how everyone begins to learn this stuff from teachers that you might sort of learn from. But to really try and sort of tap into what's the real message or practice here and what's the peripheral stuff that can fall away. So I want to just suggest or invite you to do a short practice with me if you're willing to do that. Absolutely fine if you don't want to, and this will take maybe sort of 3 minutes, 4 minutes perhaps. So if you'd like to, I encourage you to just, if you're sitting down, you can sit with your feet flat on the floor if that's possible. If you're lying down, you can lie with your hands by your sides, uncross your legs if you're lying down. If you're standing, that's absolutely fine. Maybe rest your hands on your lap or on your knees. And if you feel comfortable, you can close your eyes, but you don't need to do that if that doesn't feel right. We'll start just by acknowledging the thoughts that are in your mind right now. Just noticing whatever's happening in your thoughts, the activity of your mind, particular thoughts that might be there coming up. Allowing them to be as they are without necessarily getting drawn into the next thought that follows or going down a rabbit hole of thinking, just being aware that thoughts are in your mind. Then taking your attention to feelings or emotions that might be noticeable for you as you sit here now. And in whatever way those come to your awareness, sometimes there might be a physical sensation in a certain area of your body that ties in with an emotion. Or maybe there's some other way that you notice the fact that you're feeling a certain way in your emotions at the moment. And just noticing that too, including any tendency to want to label emotions as positive or negative, desirable, undesirable, neutral. And next, taking your attention from emotions and feelings to sensations in your body as you sit here now. And that could include contact between your feet and the floor, or the back of your legs in the chair, or the floor if you're lying down. The position of your legs and your arms, the position of your hands. Sensing into the shoulders and the upper back and the neck. Noticing particular areas of your body that seem to stand out in your awareness, particular sensations that grab your attention. And that might include discomfort, tightness perhaps, maybe even pain in certain areas. Just being aware of that as it is, without necessarily needing to change it in this moment, just allowing it to be there. And now taking your attention to your breathing as you breathe in and as you breathe out in this moment. Noticing the flow of air through your nostrils, down the back of your throat and into your chest. The rise and fall of your chest, your ribcage moving out and back with each breath. Maybe the movement in your belly as well as you breathe. And keeping your attention on those sensations of breathing moment to moment, just as they are. Now, as we come to the end of the practice, again, checking in with thoughts, the activity of your mind, checking in with feelings and emotions that are here for you now, and checking in with sensations in the body just as they are. Noticing perhaps if there's been any shift or change in those sensations in this short period that we've been doing some practice. And there might have been, there may not have been. Just being aware of that. And when you're ready, opening your eyes if you've had them closed, and bringing your attention back to the surroundings of the room. Take a moment to adjust to different awareness. I'm happy to maybe sort of ask you at the end what you might have experienced during this bit of practice, but I'm going to suggest we probably move on before we do that. But before we do that, did anyone get distracted at any time during that period of practice? Yeah, see some nods. It's very normal. So distraction is a very normal reality of practicing mindfulness and most forms of meditation. And it's not a sign that you're doing it wrong. And the moment of distraction, of realizing where your attention was on something else, perhaps a sound, a thought, a sensation that was different to where you were supposedly meant to be focusing, is an opportunity to build the mindful state of awareness, because we get the chance to redirect our attention back to the thing that we were meant to be focusing on. And it doesn't matter if that happens 100 times in 5 minutes. It's like doing reps in the gym. That's where you're actually building the skill, is that awareness that, oh, actually I was planning to focus on my breath. I've ended up thinking about what I'm doing tomorrow, and I've realized that I was, and I'm bringing my attention back to my breath. And doing that over and over again is how we sort of build up the skill of knowing where our attention is and choosing to direct it in the way that we want. So don't ever feel like the fact that you were distracted is a problem. It's more of an opportunity, I would say. Okay, so what does the research say about all this stuff? So I think this is just an interesting little graph. It's not that new. It's from 2016, but just showing the number of publications related to mindfulness between 1980, basically zero, and 2015, 674. And I would argue that by now, it's way more than that. So I mean, it's really a lot more research is happening in this area, and that's on all fronts, all kinds of ways of thinking about mindfulness and studying it. It's all happening. And I think particularly there's really strong clinical benefits. So apart from mindfulness-based stress reduction, which I was talking about before, there's also something called mindfulness-based cognitive therapy, which is really taking CBT, which is cognitive behavior therapy, combined with mindfulness skills and creating a new form of therapy. And this can be delivered in sort of an 8-week format. And when they've done this, this particular study showed that there was an equivalent benefit from doing that in people who had depression to taking maintenance antidepressants. So that's pretty interesting, right? So instead of needing to stay on a medication, people were able to get benefits from mindfulness that were equivalent in preventing relapse, which is a big thing in depression. We know that people who have depression are at risk for a relapse of depression, and we want to try and prevent that. So one of our ways of doing that is with medication. And it seems that if we train people in mindfulness-based cognitive therapy and they practice the skills, I think that's obviously important. People who sort of go ahead and take it further, they can have an equivalent outcome. And for a lot of our patients, they don't want to be on long-term medication. There's side effects. There's things about it that don't work for people. And it's useful to be able to say, well, there's an alternative here that's at least as good as what we think we're getting from medication. And for a lot of people, that's something that they'll be interested in. They want to know about that. And they've still got to do the work. Like, you've got to do an 8-week course. It's quite intensive, and you've got to practice it. So it's not, it's maybe not as easy as taking medication, and even that isn't all that easy. It's easy to forget to take medication. But it's simple in the sense that all you've got to worry about is making sure you take your medication once a day or however often it is, whereas this is about using these skills, developing them. But I think it's often great to be able to offer people alternatives. Um, Another study looking at mindfulness-based stress reduction and mindfulness-based cognitive therapy, and this was really sort of looking at trans-diagnostic effects. So this was irrespective of the diagnosis, there were real benefits for depressive symptoms, anxiety, stress, and improvements of quality of life and physical functioning as a result of practicing these things. And that was a large meta-analysis of randomized controlled trials. So this is quite powerful research in a way, looking at sort of really big numbers and seeing that this can have a lot of benefit, irrespective of what, the label in terms of the diagnosis might be. People can really gain some good benefit from this. And then this is another one here. This is for anxiety disorders. So looking at mindfulness-based interventions, which is not necessarily only mindfulness-based stress reduction or mindfulness-based cognitive therapy, but they seem to show larger effect sizes than other psychological therapies for anxiety. And we know that probably our treatment of choice for anxiety is psychological therapies, but medications can help, and we do use them. But psychological therapies are maybe the preferred option when people can access them, which is, again, is a challenge. And it looks like this would be even potentially better than that. So this is, again, a meta-analysis, pretty powerful results. And again, something we should be keeping in our mind when we might be managing someone who maybe says, well, I'm not sure that I want to take medication. Are there other options? And we say, well, yeah, it looks like there are. So it's some sort of a summary of some of the benefits of this for patients. It reduces rumination, reduces stress, improves pain management, boosts working memory, enhances focused attention, decreases emotional reactivity, enhances cognitive flexibility. Who wouldn't want these things, right? These sound useful not just for patients. I mean, these are great for anyone. And I think that's a strong reason to know about this and to point people in this direction. What about effects on the brain? So this is meditating brain. This is your brain on mindfulness. This is not actually your brain on mindfulness. I just thought it was a really beautiful picture. But there are definitely changes in the brain as a result of mindfulness. I think that's useful to know a bit about. This is where I've done some research, which I find really interesting. So mindfulness increases gray matter density, right? So practicing mindfulness results in like actual physical changes in the brain. And in the areas which are relevant for memory, learning, emotion regulation, self-referential processing, so how we sort of deal with our relationship with the world. These are the areas where this impact happens, and we would then start to understand why we would have an easier time navigating some of the difficulties of life if those are the bits of our brain that are changed by practice. There's also some impacts on the amygdala, and we'll know maybe the amygdala is involved in the stress response and sort of strong emotions. And it seems as if there's changes in what's called the functional connectivity of the amygdala. So the way in which the amygdala sort of communicates with itself internally. And this seems to result in more modulation of the stress response, which seems like a powerful effect. And again, something that we might want to take advantage of, which it steers us away from having to rely only on things like medication, maybe for people who are struggling with strong emotion. And also there's changes in white matter structure. So the white matter is obviously this sort of the superhighways of the brain. They make it all happen. So the thing about the brain that's amazing is the way it communicates with itself, and that's through the white matter. And there are changes in sort of white matter integrity as a result. So there's more connectivity in the brain if we practice mindfulness in areas like the amygdala, hippocampus, anterior cingulate. These are involved in emotional processing, and there's just the brain seems to work better after sustained practice. So this is long-term mindfulness. So there are people who've been practicing for a long time, but something to maybe motivate people towards if they're looking or show interest in this area. This is some research I was involved in, which was in bipolar disorder, and we showed that this functional connectivity change was something that could be achieved in people with bipolar disorder in areas that were relevant for emotional regulation. If we think about severe depression or severe mania in the context of bipolar disorder, that sounds like a really valuable thing to want to achieve, is allowing people the ability to have more sort of regulation of their own emotion, steers us away from excessive use of medication or excessive reliance on medication. So some summary of these effects: there's increased connectivity between the cerebellum, the tamen, the left occipital cortex. These represent strengthened interactions between areas involved in error detection and cognitive integration. So our cognitive function is working better. And also decreased connectivity between what's called the default node network, which is regions of the brain that work together, and the left hippocampus, which is related to maybe the connection between present moment experience and emotions. So does it make us less reactive? And in a good sense, we obviously want to respond to things happening around us. We don't want to be cut off from how we might feel about something. but maybe overreactivity isn't always a helpful thing. Sort of, very sort of flash responses to things doesn't always get us where we might want to go, and we might regret how we react later, whereas this maybe gives us a better sense of stability through any turmoil we might face. What about benefits for clinicians? So this is a particularly interesting area for me, and it's partly what I hope might be interesting to you, is that there's some really good value for us as clinicians working in healthcare, and you about to sort of start your long journey as doctors. We've got to look after ourselves, and burnout is a real issue. So these are some of the things that contribute towards burnout. And this comes from psychiatry trainees, so registrars in psychiatry, and these were some of the things they highlighted as contributing towards burnout. And this is during training. So this is not even people who finished specialist training. It's already, there's evidence to show that yourselves as medical students are already at risk for burnout. And it's good to be aware of that, because I think we can take some proactive steps around that. So too much work in a limited amount of time, paperwork, patients are difficult to manage, time pressures, intrusions of work on family life. I mean, it wouldn't necessarily surprise any of you to know that those would be the kinds of things that wear people down over time. So what can we really do about that? These are some of the symptoms or the consequences of burnout. So people end up emotionally and physically exhausted, become depersonalized and cynical about their work, which is tragic if we think that we often go into this sort of line of work because of our interest in people and our sort of desire to make a difference and help people, and suddenly we become cynical and we sort of lose that enthusiasm. People tend to feel a reduced sense of professional achievement, don't feel like their work is meaningful anymore, they become irritable with colleagues and family and patients, less engaged in their work, and they can obviously start to develop depression and anxiety, including suicidality. And as doctors, you are in a higher risk group for suicidality than the general population. And that's sometimes quite a shocking thing to be aware of, but we are at increased risk. Increased risk of substance misuse, and we obviously know where that can go, can sort of really destroy people's lives, and at risk for leaving the profession, which in many ways is also just as tragic. People invest a lot of time in becoming really skilled and knowledgeable as doctors, and then they leave the profession very early without maybe having a full career, and that's maybe tragic for that individual person, but it's also a massive loss to any health service to lose highly trained professionals. And there's so much need. We don't want to lose anybody. And if people are leaving because they haven't had the adequate support and they end up burning out, I mean, that's tragic. We should be able to avoid that. So the scope of the problem, in the UK, maybe 30% of doctors have symptoms of burnout. In the US, maybe as high as 46%. There was a recent 2018 article about burnout in junior doctors in Australia. And, as I said, we had higher risk for attempted suicide compared to the rest of the Australian population. And this doesn't only impact the individual or maybe the team that they work in, but this has an impact on patient safety and quality of care, because people are less able to provide best care to their patients when they're not doing so well themselves. So I think it's important to be aware of this, and maybe this is kind of capturing it a bit. We're always looking to look after other people, but maybe not so good at taking care of ourselves, right? And we've got to do that from the beginning, really be proactive about looking after ourselves and prioritizing our own well-being. So I just put in some information here, and I hope this stuff is still up to date. I feel that it is. I know you don't work at Eastern Health. This was a presentation I've given elsewhere. But if you are struggling with at any stage with stuff like this, feeling that you're overwhelmed, exhausted emotionally, you're really not coping well, reach out early for support. That can be with a mentor or a supervisor. Where you work will probably have some sort of employee assistance program. It's good to know the details of that, but external to any employer, the Australian Medical Association has peer support programs, and there's also a Victorian Doctors Health program, and all of these are very accessible resources, and it's good to know about them, even if it's to direct a colleague, someone you can tell is maybe not coping well, and that kind of "are you okay" conversation, but following through with "are you really okay?" Because people will often bat that away and say, "Oh, no, I'm fine," something that I can take it. Because that's the persona we often feel we need to show to the world, but sometimes underneath things are not so great. I want to try and finish relatively quickly, but I want to say a little bit about the Mindful Practice in Medicine program, and this is the training I've done in bringing mindfulness to clinicians as a way to help them to engage differently with their work. So that's about self-care, but it's also about the clinical encounter as a mindfulness practice itself. And this was developed by two doctors at the University of Rochester in the USA. And it's Ron Epstein and Mick Krasner, and myself and a number of other people in Australia have had the opportunity to train in this program. And the goal is to help clinicians to develop the ability to be present, attentive, and curious in clinical encounters. and to adopt what's called beginner's mind. So this idea of encountering a situation as if it was for the first time, even if you've seen 100 patients with pneumonia, or let's say you've seen 100 patients with a cough and fever, can you approach this next 101st patient with those symptoms as if it was the first time? And the idea is not to forget the things that you know, but to try and not overly constrain what you're able to notice. Because in the beginner's mind, the opportunities and the sort of possibilities are many. In the specialist's mind, there are few. We become very narrow in our thinking. We have a lot of depth to thinking as specialists. And even as doctors, we are already specialists, obviously, in a certain way, even if you haven't done specialist training. We start to become blinkered and we only see certain things and we ignore other things. And we're often looking to confirm what we already think the situation is. So there's a problem with something called confirmation bias. So we start excluding information that doesn't fit our pre-decided whatever. And we might actually be wrong. And if we maintain beginner's mind or sort of this open awareness, other bits of information can still sort of permeate and we go, actually, maybe this isn't pneumonia, maybe this is, fluid overload and this is cardiac failure. And they might look very similar at the beginning. So we keep our options open. These are simplistic examples, but the idea is to sort of keep us attuned to the actual situation rather than some generic sense that what we're seeing is the same as we've seen over and over again, because it isn't exactly the same. It's always going to be slightly different. Can we remain in touch with that? So the Mindful Practice Program offers a way to enhance self-awareness. So what's going on for me in the interaction, let's say, with a patient, my own wellness, but also resilience, the ability to stick around and stay the long course in this difficult work. It improves relationships with patients and colleagues, and they've done some good work to show that it actually improves the quality of care that healthcare workers provide. So this is a retreat that I went on in the USA in 2017. I am in the sort of second row from the front with a slightly bigger beard than I have now. And yeah, this is the way this type of practice is taught, is in a group setting, and you learn by doing. So you learn sort of the techniques by practicing with other people. And the idea is that your interactions are mindful, and you learn ways to sort of bring that into how you interact with people. So the core components of the program are formal and informal meditations. And this is about building the basic skills of mindfulness. So cultivating sort of an open and receptive, non-judgmental orientation to whatever's coming up, thoughts, feelings, physical sensations, and just sort of being with those things. Something called narrative medicine, which you may have encountered. It's not exclusive to this program. And this is about creating and sharing stories about what we do in a particular way. So often we tell our bad stories when things go wrong, and that can be very valuable. But we don't often tell good stories. And we don't often get the chance to sort of share our stories in a supportive, sort of spacious setting. It's often, in a particular setup, it's a certain type of meeting in which we would share stories, and there's often the risk for sort of judgment and criticism, and feeling a lot of power dynamics. And the way things go with narrative medicine is it breaks a lot of that down. And I see it's just a chance to get together and share stories about what we do and what we've reflected on in light of that. So what's come up for us? What did you feel in this interaction, in the story that you told? Often we put that to the side. What I feel about things doesn't matter. I'm invested in what's going on with the patient. My inner stuff it's got to wait till later. I push it down, I push it to the side. And the idea here is actually not do that, is to allow that to be part of the story. Responding to someone and being able to say, it touched me emotionally, this interaction with this person. And I'm able to share that with colleagues in a way that is sort of supported, rather than that being something that might sort of get criticized. And then, take extension of that is something called an appreciative interview, where there's a specific angle on drawing out where things have gone right. We often focus on where things go wrong, and we don't often get to highlight, even when there's been a difficult outcome or something has gone wrong, within that, there would also have been things that were done right, and where things have gone well, like someone dies, but we were able to be with them at the end, and for them to have felt supported by us being there, even though we could not save them. Within the tragedy is something that is also redeeming and valuable, and being able to draw that out and let that be seen by people is something we don't often do. We focus on the fact that death is failure for us, or pain is failure, the fact that there's ongoing pain, or there has been something that didn't go perfectly. We had this goal and it didn't go that way, but we still were able to offer good care and support the person and address some of their needs. These are all ways in which things have gone well, or we were able to really be present with them. And this program builds these skills through practice. And there's some good outcomes, promotes physical, emotional, cognitive stability for the clinicians, and it helps them to connect with their own inner resources and the sort of things that made them want to get involved in medicine in the first place and re-engage with their clinical practice, leaves them feeling more satisfied. And they also end up often discovering capacities and resources for personal growth and even organizational change. So, identifying, things aren't quite right in my health service. They do need a shift. Maybe we're not supportive enough of patients who are struggling with difficult symptoms. And people coming out of this program tend to find that they've got a better way of dealing with that and kind of approaching some of the organizational barriers to really shifting a culture within a health service. And that's a big goal. It doesn't have to start there. It starts at a smaller level, but maybe it builds up towards that. So if we can perceive that there are problems in the way modern medicine is, and I think there are many problems, many very quite dire problems that really do need to be addressed, this can be a way for us to maintain our own integrity in trying to address those things over time. And these are some research that they've done. So they've taken groups of physicians through this training, and following a 12-month intervention, the group that they initially worked with showed improved mindfulness scores. So they got the skills, but they also showed reduced burnout and increased empathy. So they were able to empathize with their patients. Now my thing isn't working. There we go. And then this was a second program that they ran, which was focused on what they called mindful communication at the time. And what they found is that people felt less professionally isolated, more able to relate to their colleagues and share difficult stories. They had better listening skills and were more effective in their responses during patient interactions. And what they found most interesting is that everyone who participated felt that it was such a wonderful thing to allow themselves time for personal growth. We're so focused on maybe career progression or really consolidating our factual knowledge or our theoretical knowledge and our skills, that we maybe don't allow ourselves time for self-awareness and personal growth. And the fact that these physicians went through this program and were accorded this time, like they were allowed to have this time, they all felt that was so valuable, because they would have struggled to give it to themselves because they felt they had to prioritize other things. And that speaks to the sort of person who ends up going into medicine. Maybe so, we prioritize other people over ourselves, and that's not always all that we should do. We need to also look after ourselves. So a summary of some of the effects of this type of program: enhances empathy and communication, increased compassion, improves counseling skills, just the ability to talk things through with people, decreases stress and anxiety, improve quality of life, reduce burnout. So lots of tick boxes there in terms of why it's useful. So what's it like to sort of do this, or bring it into day-to-day work? And maybe this is something where you might have some takeaways. So who is this right for and when? And I'm not only talking about mindfulness practice here. I'm not only talking about the mindful practice in medicine program here. This could be just basic mindfulness exercises or, mindfulness-based stress reduction. It's not for every patient, and it's also not for every clinical encounter that it's going to be relevant or appropriate to bring this in. And that's not always an easy thing to judge, like who is this going to be right for and when? And how do you introduce the idea? And so the language you use really matters, because people can sometimes get put off by certain ways in which we might introduce this, and that we'll get it wrong sometimes. And I've made that mistake lots of times. I've sort of seen someone who's obviously quite distressed, and I've suggested, why don't you do some mindfulness? And like, oh, mindfulness? No, I'm get out of the room. I don't want to deal with you. You're sort of selling this mindfulness stuff. And perhaps if I've gone in with, I can see you quite upset right now. Should we do a short exercise together that might help you to feel more relaxed? It might have worked for that person, and maybe that phrasing would have not worked for another person, and it's not easy to judge. And I think you've got to try and find some sort of focal point that the person might value. So the person might be talking about some discomfort they have in their body, or they might be talking about stress or difficulties with attention or sleep. And you could say, I feel as if there's a short practice we could do together that might help with that. Would you be willing to try it with me? And I think you've got to be willing to do this with people. It's not something you're doing to people. It's something, why don't we sit together and just focus on our breathing for a few minutes? And sometimes people find that helps them to feel more relaxed. I'll do it with you. We've got to be really quite accessible and engaged in this, not sort of walking into the room and saying, I want you to spend the next 5 minutes breathing slowly. Do it with them. You've got to anticipate certain levels of resistance, including people's concerns that you might be pushing religion on them. And obviously a lot of people have a religious orientation maybe, or a religious background, and you might be bringing in something which for people who don't know a lot about mindfulness will be perceived as maybe a religious orientation thing. And you're bringing in this thing and you're trying to push this on me. And not everyone thinks in that way, but it is something that comes up fairly regularly, and you've got to maybe have thought about that and think, how will I navigate this? And maybe you acknowledge this. Yeah, mindfulness has its roots in Buddhism, but the practices I'm bringing you have got nothing to do with Buddhism. They've got to do with how we work with our own attention. and how we learn to regulate our emotions. These aren't religious things. These are just ways of working with our own brain. And I think, having opportunities to bring this in, we start to work out what words can we use. What practices work best? I think short ones are a good place to start. The practice we did that was called the 3-step breathing space, 3 to 5 minutes, but even just a minute of quiet breathing, or a minute of sitting quietly, closing your eyes and just sitting quietly with someone, can be a mindfulness exercise. And some of those short practices are just manageable for some people. Longer ones, people tend to get a bit derailed and a bit flustered. And I would really encourage you to, if you're going to introduce this, to introduce practices that you are familiar with, that you've practiced yourself, and that you've maybe encountered some of the difficulties about yourself and navigated those a little bit. And I really think that having some form of practice of whatever you plan to offer to people is really essential. It doesn't seem the right way to go for me that you read about a practice and then go and tell someone else to do it. And I mean, that could work. And it might be that the person will get benefit from it. But I think there'd be much more value if it's something that you've done for yourself and you're coming in and offering to do it with someone. And I think it resonates so much more. I think you'll find that you can guide someone else so much more coherently if it's coming from your own experience. You can say, I do this practice regularly where I'll just sit for a few minutes and focus on my breathing, and I really find that it helps to settle me. Why don't we try that out? Or, I know sometimes when we do these practices, people might feel a bit distracted. Don't worry if that happens. It happens to me sometimes too, And you're really sort of breaking down a lot of barriers around this, and just one person to another saying, this is something that would be worth trying. And I think if you really are interested in this, it's worth getting some training and get some support around it, and even a group of people you might agree to join together with one another and practice together, or go on a formalized course. There's a lot of books out there that can guide you, and I'll point to some at the end, as a way to really build your foundation of this for yourself. And then it's so much easier to bring this in with other people. It becomes so much more natural. So just some ideas on training opportunities. This top course is actually developed by Monash. So I don't know, I know that, well, at one point anyway, I was aware that you were getting some mindfulness training as part of your studies. I don't know if that's still the case, but this is a quite accessible online course. The Mindfulness-Based Stress Reduction program is a very established 8-week course, quite intensive. You're looking at a sort of a 5 to 6 hour commitment per week. That's sort of 2.5 hours in-class time in a group, and then usually some practice time at home. Very, very valuable to build up and consolidate mindfulness skills, but a fair commitment of time and cost. But it's widely available in multiple providers in Melbourne. And then this is a group that provides mindfulness teacher training. So the Mindfulness-Based Stress Reduction program would be mostly orientated towards having these skills for yourself. But if you then felt, okay, I want to take this further, I want to become a teacher, then there's places where you could then learn to teach this for other people. And these are the sort of the various steps that you might go through. Here's some other useful resources. I'm sure you would have all perhaps heard of things like the Smiling Mind app. 10% Happier is another meditation app. There's lots of other apps. I think Smiling Mind is a particularly well-developed one. And these are other things that you can offer to patients, for example. So you might, let's say you have an encounter with someone and you do some practice together. And at the end of that, you might say, listen, it seems that landed quite well with you. And they say, oh yeah, it was okay. And you could say, well, there's this app you can download for your phone called Smiling Mind, and it's got a lot of practices on there. And then you can even just spend a minute with them setting it up and say, oh, it looks like they've got one for sleep. They've got one for when you're stressed out or when you're rushed or whatever. Why don't you try those out a couple of times until we meet next time? And they're very short practices. It's audio guided. It's very, very easy to use. And that can just be something that sustains people, because getting going with mindfulness practice on your own is a challenge for a lot of people. Even if they're quite motivated, to keep it going over time and set the time aside, and then you've got to think, well, what am I going to do? They said I should sit and my breathing and stuff. But if you've got someone guiding you with an audio guide for 3 to 5 minutes, great. It's in your hand, on the phone, very, very easy to use while you're in the waiting room, while you're sitting in traffic, trying to get the kids to bed, whatever the challenge might be that they have, there's something on there for them. There's some nice information sheets for patients. So there's one from Sane Australia, one from the Black Dog Institute. And these, again, things that you could give out to people. Have a few printed up in your room or office where you're sitting. And if someone seems to resonate with this stuff, or you're wanting to direct them to sort of a stress management strategy, you can say, here's some information for you. Why don't you take a look at this, and we can talk about it when we meet again, or why don't we go through together now? And this is the way to bring this stuff in quite a non-overly assertive or intrusive sort of way, just providing information, and it'll land well with some people and it won't land with other people, and that's fine. That's how it goes. Or someone initially won't be too interested, but a month or a year later, they'll come back to you and say, remember you were telling me about that mindfulness stuff. Could we talk about that again? I feel like I might need that. You never really know how things are going to flower at a later stage. these are two books that I think are really useful to think about getting. The one on my left called Attending is by someone called Ron Epstein. He was one of the ones who developed the Mindful Practice in Medicine program. And he talks about his own experiences, really his journey into that and how he ended up learning to do this, and lots of sort of anecdotes and clinical examples. The book on the right, Heal Thyself, is by another wonderful teacher called Saki Santorelli, who worked in the Massachusetts MBSR program for many years with John Kabat-Zinn. And he also talks about how, some of the challenges, some of the ways in which this is this is a twisty sort of journey that people go through in bringing this into medicine, but how valuable it can be. And I think they're both quite readable, quite accessible things to take a look at. Before we get to questions, I thought we could just end with a mindful pause. So again, if I invite you to participate in this, you don't need to. If you'd like to, you take this moment to just be still and quiet, like give yourself this time. If it feels right to you, you can close your eyes. Notice the contact between your body and the chair, or your body and the bed or the floor, wherever you're sitting on, lying down maybe. Just noticing that contact with your skin, the pressure from whatever your body is pressing up against, maybe even the pressure of the your body on itself, if you're resting parts of your body on itself, or the contact with the fabric of your clothes against your skin. And then taking your attention to the sensations of your breathing. So you breathe in and out in this moment. When you're ready, bring your attention back to the surroundings of the room that you're in. I just want to say a quick thank you to some of my teachers, and that includes colleagues and patients, where I've been able to sort of bring this in and learn from other people's experience. And I want to say that I think this captures something of what we've talked about. So maybe we're working towards having the mind of the dog, maybe. Yeah. All right. So that's sort of the formal part of the presentation. I'm happy to take questions, or anything really that's helpful.
Thank you so much. That was really great. And coming into this event, honestly, I totally overlooked the part about doctors practicing it to become better doctors, not just giving it to patients. So that was really good. I think that was my big takeaway.
Great. Yep.
Awesome. All right. So while people are doing that, I'm just going to read out some of the most popular questions first.
Great.
So the most upvoted one is, how do you approach addressing mindfulness to stressed patients?
Yeah, usually having found some sort of rapport with them already. So however, I wouldn't usually do it as the first thing I might say. So often midway or towards the end of an interaction. The fact that I work in psychiatry is quite helpful because I tend to be able to spend more time with people. Whereas I think people working in other disciplines maybe don't always have that luxury. But I think it's useful to have established some sort of contact with the person to get some sense from them of how receptive they might be to anything that you might suggest, whether or not it's got to do with mindfulness or not. But from there maybe to be some sense that you've developed a bit of rapport, they somewhat receptive to you, and you've had a supportive sort of interaction where they felt maybe heard or validated by you in some way. So you kind of develop some sense of being on their good side a bit. And then to whatever the language might be that allows you to highlight back to them, based on what you've told me or what I've been able to notice, it seems as if you're going through a lot right now. And I can appreciate how much of an impact that might be having on you. And we know that can cause people to feel quite stressed or anxious, or maybe just be struggling with some difficult emotions. And most people are able to sort of acknowledge on some level that might be true. So they'll say, yeah, you're right, I am struggling, or, yes, I'm feeling very anxious right now. And some people will be very upfront about that. That'll be the first thing they'll tell you. And then similar to what I was saying before is something around saying, well, for many people, we've found that short breathing exercises are often a useful way to help them to manage their emotions. Would you be interested in trying something like that with me? And often I go with breathing as a first step because it wouldn't, for most people, it wouldn't be the first time they've heard of something like that. They might not have ever done it before. They might not automatically, naturally gravitate toward it, but most people have been told at some point in their lives that, when we're feeling a bit overwhelmed, breathing is a useful way to manage that. And all you're really doing is maybe sort of highlighting that again, but also offering to actually do something with that rather than just telling them, oh, breathing exercises can help. You should go home and do that. Allowing enough time in the interaction to say, well, why don't we try it out? And just keep it really, really simple, So, and obviously, assuming they say yes, say, okay, well, why don't we just sit here together now and just breathe slowly and deeply for a few minutes? And you can make the offer of, closing the eyes if you feel comfortable, which you don't need to. That will probably be the most common way that I would go about it, something along those lines. Yeah.
All right. And the next one is, how do you help patients who don't have time for mindfulness?
Yeah. So it's helpful often in that sort of situation that it's someone who you might get the chance to see more than once, but that's not always easy to guarantee. So if you're working, let's say, in a general practice setting, and this is a patient who you can be fairly sure that you might have further encounters with, then you've got time to work it out. And so in a first encounter, you might provide them just some information. You might say, I feel mindfulness is something that could really benefit you. Here's some information about it. Why don't you just have a quick look at this, read through, a pamphlet, or, send them to a website, and we can maybe discuss it when we meet again. Let's set up another appointment. And then they might come back with some questions or some ideas. And then you might talk to them about their, their schedule. They might say, oh, no, I'm so busy, I'm so rushed, I don't have any time for this. All you really need to help people to be able to do is identify 3 to 5 minutes, and most people can do that. Even 1 minute. It's very, I wouldn't easily believe someone if they told me they can't find a minute in their day. And sometimes people will resist that idea, but you've got to, that's where your kind of counseling communication skills come in to say, okay, well, let's just sort of step back and really look at your day. Where might be these little gaps? And that can be the 10 minutes that you spend standing in a queue somewhere. You're not doing anything else in that time. I mean, you might be looking at your phone, but there's no other urgent thing pressing on you that you can't use those 10 minutes to practice mindfulness. And people say, oh, I'm not sitting down, or, it's busy in the mall, whatever. Earphones in and load up the app, and you can use 3 minutes of that 10 minutes doing the mindfulness practice. So you've got to try and work with people around where are some practical, actual opportunities. And then I think it's about being ready to provide them something that slots into that time. And that can be a practice that you can teach them, like some of the, like those 2 practices that we did today. But I think that's particularly where the apps become really useful. And to not just tell them to go to the app, but to actually get, in the discussion, get the app out. And, tick the boxes at the beginning. You set up a profile and say, I'm struggling with stress and sleep. And then it'll blurb out 3 or 4 practices that it recommends. And you say, okay, well, why don't we try one of these in these 2 minutes? They're already sitting with you. They've got that time at least. So getting them to try it once builds the likelihood that they'll do it again, rather than just saying, I want you to download that app and go away and try that at home. Less likely that they're actually going to do it. And then let's say it lands reasonably well, try and think through with them, could this be something you could do in the 2 minutes before you close your eyes in bed? That time is fairly protected, and losing 2 minutes of sleep, irrelevant. But maybe it actually helps you to sleep better. Or could this be just before you stand up out of bed in the morning? Could you take 2 or 3 minutes to do this? Once you're up, it might be hard because you're rushing around the things of the day, or in the moment that you first sit down at your desk before you look at your email. Is this a 2 or 3 minute opportunity that you have for something? And you've got to work around people's schedules, and there will be resistance. And I think the value of trying to get people to do something with you when you're with them maybe gets to a little bit of that, because they might get some sense of the value, and then they're more likely to go ahead and keep going with it. Yeah.
Thank you. I think we'll just go with 2 more questions, so
Okay.
we'll try and stay to time as possible.
Yeah, no problem from my side.
So the next one is, do you find that mindfulness just doesn't work for some patients? And how do you approach patients who are skeptical about the value of MBSR?
Yeah, so I think mindfulness can work for everyone. I think there's certainly people who will say that it can't work for them, but then it's worth exploring that. What has been their experience of mindfulness? What practices have they been exposed to? And people say, oh, they made me sit, and it was so still, I had to close my eyes, and then, I got distracted. And people have often had poorly managed experiences of mindfulness. They were maybe having an experience with in a group with someone who was meant to be facilitating, and that person maybe wasn't holding the situation in a particularly useful way, and they ended up having a negative experience. And then they were put off by that. Or, they found a particular practice wasn't easy for them to do for whatever reason. They felt uncomfortable. They found it triggering to close their eyes. It was too long. They were required to sort of sit for 30 minutes. And they're like, well, that's unrealistic maybe the first time you want to practice this. So you've got to explore a little bit and find out what their actual experience was, and then offer them alternatives. You can say, yeah, well, it sounds like that was a really long practice and you really struggled with being distracted. Why don't you do a 1-minute practice? Or it sounds like sitting practice doesn't seem to work for you so well. What if we do some mindful movement? Let's stand up and just sort of move our arms in a sort of calming way and notice the sensations of doing that. There's so much variety of ways in which you can practice that I feel like you can find something that suits everybody. And one way to do that is to expose people to that variety, instead of it just being that you've got to do a awareness of breaths while sitting in the lotus position, And I think that's where mindfulness does offer a lot of scope. And I think if we can have enough knowledge of the variety of practices ourselves, then we're able to maybe more easily meet people with a recommendation on, maybe that wasn't quite right for you. Why don't we do some mindful walking? Maybe the breathing is difficult for you. Let's just focus on sensations in the body. That's okay too. And this is where your own foundation of practice becomes really valuable, because it's useful to have tried all those things out yourself and hit up some of the difficulties with them and kind of gone, well, I did find that practice difficult, and sometimes we've got to push through that difficulty and keep trying with it. At other times, we might just go with the practices that we do feel comfortable with, because it's something we're more likely to do. But I think there's almost always a way to navigate around that kind of resistance.
Thank you so much. The other question that I think I'll just quickly address now is whether the slides are going to be available. So you said you were happy to send those to us, is that right?
Yeah.
Fantastic. Yeah.
So
slides will be available. We're recording this this presentation. So we'll make those resources available to anyone who would like those. And if you haven't already, grab a raffle ticket. We're just going to do a quick little annotation exercise so that we can just share what we've learned today, and then Tom will wrap up and give a lucky person a subscription to Headspace. So I'll stop sharing my screen so we can bring up the annotate.
Thank you, Leila. And a big thank you also to Joe. That was absolutely amazing. Great information and great presentation as well. So now let's do a quick interactive exercise. So I'm just going to share a whiteboard, and I would like everyone to just write down one thing they took away from Joe's presentation today. So here it is. So if everyone wants to click on like the text box icon and write down maybe one thing that they think is a really key takeaway from today. I'm just going to start reading out some of them. So many different ways to be mindful. It's not about it's not so much about what you do, but how. Mindfulness helps develop a better sense of who you are. Practical resources, which are useful. Awareness, increasing gray matter density. Doing the mindful practice with patients in the clinic. I like that one. To have a trauma-informed approach to medicine. I hadn't considered that before. Practical resources, which are useful. Nice. Introduce mindful practices you are familiar with. That's interesting. Identifying why relevant to the patient. Approaching mindfulness gently and together with the patient. I think that's a really good point as well. Sometimes we try to force ourselves to do mindfulness, but doing it gently is a big part. lots of things I think that I hadn't considered before about doing mindfulness that now I think Joe's brought to our attention, which is really, really great to see. I'll save that so then we can share it afterwards. And I'll bring that back to Leela and Tom to draw a ruffle now. Oh, I like the love hearts. Love hearts down here as well.
Thanks for having me, and all the best. I think you got the right intentions in wanting to know more about this stuff. So yeah, good luck to everyone.
Awesome. Thank you so much.
Bye.
Thank you.